Now, we're quickly trying to move to the next discussion as regards orthopedics. This is under surgery, okay? And we're trying to look at, you know, the shoulder dislocation, particularly the anterior shoulder dislocation, okay? Shoulder dislocation, the anterior one. So when they say anterior shoulder dislocation, they simply means it's a shoulder dislocation, and the dislocation, that's the head of the humerus, is coming to the front. You understand? That's just what they mean by this. So it's actually one of the most common types of shoulder dislocation. So the head of the humerus here is slipping forward from the glenoid socket. So usually it occurs after trauma, you know, or sports. You understand? All those contact sports and all of that. And there's a whole lot of symptoms accompanying it, which we get to look at it. So what happens in this anterior shoulder dislocation? So it typically occurs when the arm is forced into abduction and external rotation. Okay, like you also fall on outstretched hand and the rest of it. So the anatomy involved is the humeral head is moving out of the glenoid cavity. So it's now damaging the labrum. That all these structures here that are kind of like holding the joint together. Do you understand? So it damages it. It can causing a Bankart lesion, or you can have a humerus lesion where there's like a compression fracture on the head of the humerus. So it's most common. About 90% of shoulder dislocation are anterior shoulder dislocation. So this is an X-ray trying to show it. Okay. So symptoms: there's a lot of pain, and the person cannot be able to move the shoulder very well. And you could see that if you observe around the shoulder, there's a visible deformity you can see. You know, so swelling and bruising around the joint, numbness or tingling if nerves are affected. So muscle spasms can also worsen the pain. So you diagnose this just like I have the imaging here. It could be X-rays, it could be CT scans. You know, then treatments include emergency reduction, that's close reduction. It's performed in the hospital under sedation or anesthesia. You immobilize where you can sling up the hand for about 1 to 2 weeks. You know, then you can be putting cold ice there and also non-steroidal anti-inflammatory drugs to reduce the pain and swelling. So physiotherapy is said that early exercises restore range of motion and strengthen the rotator cuff muscles. Then surgery is considered if dislocation is coming up and up and up again. Okay, so this is what we have for anterior shoulder dislocation.